Tell us about this new clinic and what it's going to offer to people.
Sure, this is incredibly exciting, for us. This has been in the planning stages for a long time. And one of the most important things for us has been the ability to expand the services that we offer to our veterans. So what this will allow us to do not only is have a state-of-the-art facility, but allow us to provide new services that we haven't been able to provide in our current space because of not enough room to really do that. So now we'll be able to offer nuclear medicine studies, which allow us to do stress testing for veterans directly right here in our clinic. We can do what we call ultrasound, which is another type of radiology procedure which allows us to do this work here, which previously had to be done in our Ann Arbor facility. We will also have audiology services. So veterans, as you know, hearing loss is a common complaint. We'll be able to expand our audiology services. We piloted a bit down in our current clinic, and now we'll be able to expand those services. Occupational therapy is another therapy that we haven't had previously in our facility, and now we'll be able to do that as well. And they work very closely with our physical therapist. So this is a way that we can help some veterans who are trying to get back into work and go through rehabilitation, and we'll have all those services directed right here in this new clinic.
And when will this clinic be up and running?
We're dealing with construction, my friend, so the planned timing is for the 19th of September, and things are moving along very well in that direction.
Okay. Anything else that we missed that you'd like to add?
Well, the other thing that's really important to us is the relationship that we have with the community. So not only are we providing sort of clinical services, we have space here where we will be able to have conferences. We have educational conference rooms here for veterans in the community. We have other of our health partners and partners in the community who will also be able to potentially take advantage of some of our space and have conference rooms here that they can actually use. Our veteran service officers will be present here and provide better services for our veterans in that way as well.
Okay.
I just have one more question.
Certainly.
What are we going to see on the tour?
What are you going to see on the tour? Well, if you're going to go through the entire building with us, you will see spaces where we will have veterans have an opportunity to work on computers here, and so they can get information. They can look at things like all their appointments online directly. You'll see where we'll be able to do that. We'll have places here where veterans will have, again, conference rooms and have educational space. You'll see our audiology area, physical therapy area, our ophthalmology, so our eye clinics we have here as well. You'll see where we have our big new pharmacy area, our radiology suite that we have, and our physical therapy areas as well. So you'll see that, and then the clinic areas that are set up so that there are hallways where teams of doctors and nurses and clinical pharmacists and social workers will be able to support patients, in addition to our mental health area where you'll see where we have group rooms and individual places where we take care of veterans.